In its war on sugar, the government plans to increase the excise duty on sugary drinks from January 1st. Professor Dr. Sharifa Ezat Puteh from University Kebangsaan Malaysia emphasizes the need for such measures to mitigate the rise in non-communicable diseases such as diabetes.
There's almost like 50 to 74 countries that has implemented some sort of sugar tax. Now, what it does is that with the increment in tax, it also sometimes most likely to lead an increment in the sugar beverages as well. So what will happen is that there's less consumption of so-called sugar coated drinks, sugar beverage, and this leads to a reduced consumption of sugar generally among the population. So some of the models that have been sort of put up is that, the tax actually reduced about 9.2% of sugar consumption. And if we are to move forward, this reduction in consumption, sugar consumption, would be beneficial for the whole nation. Now that we know that non-communicable disease, specifically diabetes, is on the rise in Malaysia as well. At the moment, the current so-called conundrum is that we are also, in a way, subsidizing some of the sugar companies or production of sugar. And that leads to a wide discrepancy. So increment of or putting up the tax would reduce consumption, but you should not be subsidizing the production of sugar.
However, Professor Sharifa warned that the impact of the tax will be gradual.
From what we have at the moment, the sugar tax is considered one of the lowest in even Asian countries. So the impact will be slow. In a way, what happens is that, it will not be a straight away reduction of obesity or diabetic, but we will, some of the literature will say is that you can only see the impact after some time, which is about 3 to 5 years. But you can see the direct impact would be the lesser number or lesser amount of sugar consumption. It would translate to a higher, price for certain SSBs, and in a way, this would reduce, purchasing power of certain population towards that, which is already, unhealthy drinks and so forth. You have to take your healthcare seriously. Example, the high burden of diabetes leads to a lot of kidney failures. And when you are obese, you are also likely to have, some changes in your liver, and you may get fatty liver, in the end, liver fibrosis, and also liver failure. Of course, that's the extreme end, and we already see the changes in the population having all these problems. And this is very important why the population needs to keep themselves healthy and prevent the disease at bay as much as possible.